Good morning, and thank you for being here today. My name is Fernando Garcia, and I am a community health worker for the Department of Social Work and Community Health at Rush University Medical Center. Today, I will be talking about Illinois Medicaid redetermination. I will explain what it is, why it's happening now, how the process works, and what people can do to avoid losing their Medicaid coverage. But the question is, what is a medical redetermination? Medicaid redetermination is the yearly process used to confirm that someone still qualifies for Medicaid. The states review things like income, household size, and residency. Everyone who receives Medicaid must complete the process to keep their coverage. But the question now is, why is this redetermination happening now? I never heard of this before. Well, during the COVID-19 pandemic, Medicaid renewals were paused and people kept their coverage uh, automatically. Those protections have ended since April 2023, so Illinois has restarted regular eligibility reviews. This means individuals now need to actively renew their coverage again. But how does it work? How does redetermination work? Well, the state renews notice either by mail or through an online Medicaid account, and individuals must review their information, report any changes, and submit any documents if needed. Each notice includes a deadline and is very important to respond to that letter and the date that the letter states. Always remember that IDHS or the Office for Medicaid is not going to text you or call you. They're going to communicate by you either by mail or through the portal if you have an online Medicaid account. But what can cause loss of coverage? Many people lost Medicaid coverage for administrative reasons rather than eligibility reasons. This can happen if someone doesn't open their mail, have outdated contact information, misses a deadline, or does not submit any required documents. That's why it's very important to open all the letters that you receive from the state of Illinois. And how can you stay converted? Well, to stay covered, people should open all mail from the state, keep their contact information updated, and respond to renewal requests on time. If someone needs help, it's very important to reach out as soon as possible rather than waiting and lose coverage. But why does it matter? Why Medicare redetermination matter? Well, Medicare provides access to essential healthcare services like doctor visits, prescriptions, and preventive care. Losing coverage can result in gaps in care and higher medical costs, which can have a serious impact on people's health. That's why, again, it's very important to keep on top of this and review all the information that is being sent to you. Illinois has an AVE website account, which is an application for benefit eligibility. This is a really good resource for everybody because this online portal allows individuals to complete renewals, update information, and upload documents using a phone or a computer. Using AVE can make the determination process easier and faster. However, if you don't have any of these resources, you can always go to the nearest DHS office by you or call the state for asking for your website. To conclude, Medicare redetermination directly affects people's ability to access healthcare. Many individuals lose coverage simply because they miss a notice or deadline. Staying informed and responding on time can make a big difference. Thank you very much for listening to me.